Good morning, everyone, and welcome to today's health webinar titled Deteriorating Air Quality Impact on Health, presented by The Hindu as part of our ongoing health webinar series. In recent years, India has witnessed a steady and deeply worrying decline in air quality. Particulate matter levels continue to rise across major cities, and even semi urban regions are increasingly recording polluting levels far beyond safe limits. While we often speak about pollution as an environmental issue, the truth is that it is fundamentally a health crisis, one that affects the lungs, the heart, the brain, and overall well-being. So, in today's session, we'll explore how poor air quality affects lung function, immunity, and long-term respiratory health, why children and older adults are more vulnerable to airborne toxins, the increasing link between pollution exposure and chronic diseases, clinical guidance, preventive steps, and policy level interventions required to safeguard public health. We are joined by three distinguished medical experts. First, we have Dr. Koushik Muthivanan, Professor of Pulmonary Medicine, Founder and Director, Lung Clinics in Chennai Institute of Pulmonology, Head of Department, Sri Muthukumaran Medical College, Chennai. Dr. Koushik is a leading pulmonologist known for his extensive clinical and teaching experience. His work spans the management of respiratory diseases, advanced lung diagnostics, interventional pulmonology, and public health-oriented lung care. He'll speak on how worsening air quality affects lung health, including airway inflammation, asthma, COPD, risk of long term lung damage, and the growing burden of pollution linked respiratory conditions. Next, we have Dr. Janani Sankar, Paediatrician and Medical Director, Kanchi Kamakoti Child Trust Hospital, Chennai. Dr. Janani has held several roles in pediatric organizations, contributed to national clinical guidelines, and has an extensive academic record with numerous publications and textbook chapters. With expertise in infectious diseases, rheumatology, hematology, and pediatric emergency care, she brings a strong clinical and public health perspective to today's discussion. She will speak on how air pollution affects children, including rising asthma cases, reduced lung development, greater infection risk, and the need for stronger protections for pediatric health. Next, we have Dr. Priyanka Rana, consultant geriatrics, Apollo Hospital, Chennai. Dr. Priyanka is a geriatric specialist with more than 8 years of experience in optimizing health outcomes for older adults. She trained at SRM Medical College, Chennai, and completed her postgraduate specialization in geriatrics at MGM Hospital, Mumbai. Her key areas include comprehensive geriatric assessment, chronic disease management, dementia, and cognitive care for risk prevention, frailty evaluation, polypharmacy correction, and palliative support. She will discuss the heightened vulnerability of older adults to polluted air, including chronic lung diseases, cardiovascular risk, cognitive impact, and what families and caregivers can do to protect elderly individuals. Welcome to you all to today's discussion. And audience, you're welcome to share your questions in the chat box throughout the webinar. We'll be addressing them during the Q&A section towards the end of the session. We kindly request you to avoid personal diagnostic queries, which are best handled in private consultations. So let's begin the discussion. Dr. Koushik, may we invite you to begin your presentation on the respiratory impact of declining air quality, early symptoms to watch for, and the long-term consequences on lung health. Over to you, Doctor.
Thank you, Athira and Hindu for organizing this very important topic for this millennium, like air pollution. So it's a very unexplored topic, and then the effects of air pollution is actually taking a toll on everyday health. So to start with, I would like to do a small brief presentation so that it will be easy for the public to understand. So I'm Dr. Koushik. I work as a professor and a chief pulmonologist at Chennai Institute of Pulmonology, Lung Clinics, and Muthukumaran Medical College. I'm trained in lung transplant from Vienna and Chicago. So can I have the next slide, please? So the agenda of today's session would be to know what is air pollution and what all could cause air pollution, and why is it so important, what are the health effects that could happen because of air pollution, and how to assess these health effects, and how to prevent these harmful effects, and final tips and takeaways. So according to WHO, air pollution is contamination of the indoor or outdoor environment. This is very important. We usually think it is only the outdoor air pollution, but indoor air pollution is equally important because we spend a lot of time inside our houses, and if the indoor air is not clean, then that is also going to contribute to a huge impact to your health. By any chemical, physical, or biological agent that modifies the natural characteristics of the atmosphere. So when any physical, chemical, or biological agent changes the natural characteristic of your living atmosphere, it is called as air pollution. And clean air is fundamental to health. So why air pollution is a concern? The burden of diseases due to air pollution is now estimated to be on par with diseases occurring due to unhealthy diets and tobacco smoking. There is a new saying which is called as air pollution is the new smoking. So that is why air pollution becomes a matter of concern today. So what does WHO says? In 2015, World Health Assembly adopted a landmark resolution on air quality and health. It says recognizing air pollution as a risk factor for non-communicable diseases like ischemic heart disease, like heart attack, stroke, chronic obstructive pulmonary diseases, asthma, and lung cancer, and also other types of cancer. It also says the economic toll they take and the global nature of the challenge calls for an enhanced global response. So what are the few common sources by which indoor and outdoor air pollution can happen? Number one is household combustion devices like your fuel which you are using for cooking. 2 is motor vehicles. 3 is industrial facilities. 4 is forest fires and indoor dust. Agriculture practices like burning crops and waste management is also a very important component of creating or causing indoor and outdoor air pollution. So what are the pollutants which are of concern, especially for health, is anything with particulate matter of 2.5 or particulate matter of 10. So this we will discuss in the future slides in detail. These are the tiny particles that can enter into the lungs and cause permanent damages. The other pollutants of health concern are nitrogen dioxide, ozone exposure, sulfur dioxide, carbon monoxide, and volatile organic compounds, which can also harm the human health. Next, please. So this is a very important slide which actually describes how small is particulate 2.5, particulate matter 2.5. Here you could, what you're seeing here is a human hair which is 50 to 70 microns in diameter. In this you could see the particulate matter which 2.5 which occurs in combustion as a product of combustion particles or organic compounds or metals etc. is around 2.5 microns in diameter. And here you could see dust, pollen, molds, everything is around particulate matter 10 in diameter. So this is a fine beach sand which is around 90 microns in diameter. So these are very important things which you have to know to understand how fine these particulate matters are and how they can actually enter into our lungs and into the bloodstream also. Because once the particles enter into our lungs, from the lungs, it directly goes into our bloodstream. So that is why we should be very careful with these air pollution due to PM 2.5 and PM 10. Next. Yeah. So those sources of particulate matter, in human sources, we have construction dust, which is particulate matter 10, diesel engines, which is particulate matter 2.5, boilers, which is particulate matter 2.5, open burning, which is particulate matter 1, wildfires is again particulate matter 2.5, open burning, like we discussed, is particulate matter 1, and there are also dust storms which causes particulate matter 10. So these are the human sources and these are the natural sources which you should be aware of, which can cause such fine particles that can damage your lungs. So what are the short-term and long-term effects once you start inhaling this particulate matter 2.5 or particulate matter 10 is, The immediate short-term effects can be cough and breathing difficulty, eyes, nose and throat irritation, headache and anxiety, skin irritation, and allergies and acute lower respiratory tract infection. But these are all short-term effects. When you come to the long-term effects, here you could see the most dangerous diseases like stroke, cardiovascular diseases, COPD, lung cancer, and chronic respiratory infection, and even diabetes can be triggered by this long-term exposure to particulate matter 2.5. Coming to the diseases that can be triggered because of these indoor or outdoor air pollution, the predominant diseases are patients suffering from bronchial asthma. They can have frequent exacerbation, that is frequent wheezing attack, without knowing the attack is because of the indoor or outdoor air pollution. COPD, again, one of the very mysterious lung condition because of smoking, can also right now proven to can occur because of air pollution. And there can be a sudden decline in lung function in COPD patients. In patients suffering with chronic bronchitis, there can be mucus hypersecretion irrespective of taking medications. And lung cancer, especially the particulate matter 2.5 arising from diesel, it is actually notified as a carcinogen that can cause lung cancer. And people suffering from interstitial lung disease can have an accelerated worsening and lead to lung failure by this air pollution. So what are the subtle symptoms that can go unnoticed because of your air pollution? So if somebody is having mild morning cough or a frequent throat clearing, reduced stamina or breathlessness while climbing, new onset wheezing during exposure to dust, dry cough after cooking or cleaning, recurrent viral infections, especially respiratory tract infection, and voice changes. If they could have any of these symptoms, and they can also make sure if they are getting exposed to any of the indoor or outdoor air pollution, then they should be very cautious, because these could be early warning signs of air pollution causing these symptoms. Coming to air pollution, lung immunity, which is very, very important. Air pollution does not only cause diseases, but it also decreases the immunity which the lung provides. For example, you could see air pollution causing oxidative stress and damaging the airway lining, that is the windpipe lining. And it can also cause impaired ciliary movement. Cilia is a small structure which helps to brings out the sputum every day or phlegm every day. It will impair these things, and it will cause poor mucus clearance, which can lead to recurrent lung infections. It also can cause dysregulated immune cells, and which can lead to chronic inflammation in your lungs as well as in your body. Altered microbiome of the lung. So lung actually has a basic microbiome structure which actually gives us a good protection, but then because of air pollution it can alter the microbiome, and then it can also have increased susceptibility for infection and persistent low-grade inflammation, which can cause autoimmune lung diseases. So traditional indoor air pollutants which you should be aware of is traditional cooking, out of which a particulate matter 2.5, that is when you're using fossil fuels like wood and everything. So it can cause particulate matter 2.5, causing bronchitis and COPD. Incense sticks, which we usually use, it emits benzene and formaldehyde. It can cause asthma. Mosquito coil, it emits synthetic pyrethroids, and it can cause cough and wheezing. Your cleaning agents, day-to-day cleaning agents, has a lot of volatile organic compounds which can decrease their lung immunity. The air fresheners and camphors which we use have a lot of aerosols and allergens. It can trigger allergy related reactions. And poor ventilation, this is very, very important. Make sure your windows are wide open, there is cross ventilation, or else the poor ventilation actually causes increased carbon dioxide accumulation, leading to headache, brain fog, and fatigue. So what are the proven protective measures? You could see N95 masks have very good effect when you're going out in a polluted area. When you're thinking about indoor prevention, you can have air filters with HEPA filters, which actually works well, and improve your ventilation and cross ventilation. Indoor plants like snake plant, peace lily, and acria palm can help to some extent. Clean fuel for cooking, especially you can switch to convention electric cooking, and avoid indoor smoke in any form. This is very, very important. Let it be incense sticks or let it be mosquito coils. Make sure you avoid it at any cost. Coming to air quality index, what you need to know, this is very, very important. The air quality index of each city is available online. Just make sure what is the today's air quality before you go out every day. And if it is more than 100, then it means we have a poor air quality, and you could have problems because of that air quality. So if it is more than 100, please wear a mask. If you're not able to afford a N95 mask, at least you can wear a surgical mask. It will prevent up to 60% of pollutants getting into your lungs. So next slide. So fine particulate matter, again, you have to know where does it come from. We discussed how it can affect your health. We have already discussed. And prevention strategies. You can check for a local air quality. When you're using a bike, walk, or use instead of using that, you can use a public transport. Then you can limit intense activities when the air quality is bad, or you can limit exercising when in highly busy roads. Adhere to local burn bans, and then consider indoor alternatives. So these are the main important things which you can do to avoid particulate matter 2.5. Next. So what should people with lung diseases do? Adhere to proper therapy. Flu and pneumococcal vaccination. Flu vaccination you can take every year. Pneumococcal vaccination once in a lifetime you can take. Regular airway clearance techniques you can follow. Preemptive inhalers during monsoon seasons. You can also take vitamin D and vitamin C supplements, omega-3 supplements. You can also do steam inhalations if possible. You can take saline nasal rinse. That will also help to remove a lot of pollution burden from the nose. Lifestyle adjustments. Exercise should be done during low pollution hours. Hydration, good nutrition, breathing exercises support lung resilience. So what are the technological solutions? We can move into electric vehicles, green infrastructure, smart city planning offer long-term solution for pollution control. Like a policy change, we can government can start doing electric vehicle initiations, and also strong rules for waste management and burn management. So final tips and takes away: air pollution impacts multiple organs, not just lungs. It is preventable with awareness, policy action, and lifestyle change. Check your air quality index every day, wear appropriate masks, get vaccinated, and stay hydrated.
Thank you, Dr. Koushik. That was pretty detailed presentation. And audience, you can keep dropping your questions in the chat box. I'll take them towards the end of the session. Shall we move to Dr. Janani, please? I invite Dr. Janani Sankar to speak on how air pollution affects children and more.
Thank you, Dr. Athira. Thank you, Athira, for that nice introduction. I should thank Dr. Koushik, who made my job very easy. He gave a very nice introduction about the particulate matters. And dealing with children as pediatricians, we do find a lot of difference in the lung health of children in the last 4 to 5 years when compared to what it was about 10 to 15 years ago. There's a lot of children coming in with wheezing at a very young age. This is because of the poor air quality. Not only the outdoor pollutants, as Dr. Koushik mentioned, indoor pollutants are also play a major role in children, because the smaller children usually spend most of the time indoors. The indoor pollutants, we always tell the parents, the invisible dust from the AC filters, from the curtains, the pillow covers, the bed covers. These are the places where the bed is the place where the child spends most of the time during the day. So the bed covers, pillow covers, the curtains, the AC filters have to be cleaned periodically. They have to do a deep cleaning at least once in 2 weeks or once a month at least. That's what we normally tell. And the pets are the other source of allergen exposure to these children when they are at home. And of course, if the parents, father or the grandfather smokes, passive smoking is yet another important pollutant that harms the lungs of these growing children. Why are the children different from the adults? The children are still young and their airways are still growing. Airways are immature and it grows until adolescence. And the lung health is purely depends upon the airways. And they also inhale, their breath rate is more. If you look at the respiratory rate of a 5 or 6 year old, it's about 30 to 35 per minute, as against the respiratory rate of an adult, which is about 15 to 20 per minute. So the amount of pollutant that they inhale is more when compared to an adult. And also the immune system is immature in the children, and so they don't have that much of immunity to fight against these pollutants which cause damage to their lungs and airways. So the as Dr. Koushik mentioned, the 2.5 and the 10 p.m. are very, very important. 2.5 p.m.s are usually from the household diesel, gasoline, and other uh, pollutants, and whereas the 10 m is usually from the outside, the agricultural waste, the industrial waste, and the land burning of the grass and all that produces the particulate matter 10, and these settle at a very low level, and children being very small, they easily get in contact with these pollutants which get settled in the ground because of the gravity. So I think not only the lung, they land up with frequent wheezing at a very early age. We call it as hyperreactive airway disease. They get, they become a candidate for a chronic reactive airway disease. They need to be put on MDIs and spacers at a very early age, and they sometimes they can also land up with interstitial lung disease because of these pollutants which get deposited in the alveolar and the interstitial spaces. And what happens in the long term? It not only affects the lung health but also affects the cognition of these children, because chronic hypoxia leads to some amount of poor cognition and development. Older children lose a lot of school days, and the school performance goes down because of school absenteeism and also because of the poor cognition. The developing brain gets affected because of chronic hypoxia, and the child bears the brunt of it as they grow up. So I think as parents, prevention, as Dr. Koushik mentioned, for the children, we always tell the parents not to take them to crowded places unless it's really necessary. When they are still young, maybe less than a year, we always tell them to avoid crowded places. And if at all they go, probably wear a small mask for the adults. And adults who have respiratory infections, avoid coming in close contact with the babies, especially the ones who are less than 6 months, as the immune system is still very immature. And also get them vaccinated adequately. All the government now has started giving the PCV vaccine, but those of them who got the vaccines earlier, before the government introduced the PCV vaccine, if they had got it from the government, they should take one dose of pneumococcal vaccine and also the flu vaccine yearly once during the monsoon months around August, September. The ones with underlying chronic airway disease, we recommend flu vaccine at least twice during the year. The ones who are healthy, we at least one dose they need to take during the monsoon months. And of course, keeping the indoor, the parents always tell, when we tell you keep your house clean, yeah, my house is very clean. We always tell them it's not the visible dust we are talking about. We are talking about the invisible dust, that is the 2.5 p.m., which the child inhales without, continuously the entire family inhales without their knowledge. So I think prevention is best, and we have to keep our surroundings clean and get them vaccinated, avoid going to crowded places, meet your pediatrician when you have a cough which is unremitting and disturbing the sleep. And these children, and avoid the myth of using inhalers. There's a lot of myth for using the inhalers amongst the parents. I think that myth has to be broken by the pediatricians, and they have to start adhering to the constant and regular use of MDIs and spacers. And if they do that, I think the lung health will definitely improve. Thank you.
Thank you, Dr. Janani. Thank you so much for the detailed presentation. Shall we move to Dr. Priyanka now? I welcome Dr. Priyanka to discuss pollution's impact on the elderly specifically.
Thank you, Athira, and thank you to the Hindu group for having me here. I did have a presentation, but as I see, Dr. Koushik has got everything covered that we wanted to, talk about, especially with regard to elderly. But there are a few things we would want to talk about is the physiological reserve of an elderly person. So can we move on to the next slides? Yeah, one thing I would like to mention specifically here is in elderly, things are little different. As in, as just like children, they are also one of the vulnerable groups, and it starts affecting both respiratory, cardiac, as well as their neurological and metabolical health. So, pollution can contribute to all of these systems specifically for elderly. Can we move on to the next slide? Yeah. So this is what I was talking about. What happens, which are age-related changes that can actually, lead to more trouble, especially in an elderly person, So automatically, because of age, some things happen to your body, some physiological changes happen to your body naturally. The first thing is your lung capacity is automatically reduced. Okay. So as a result, that decreases the ventilation efficiency and gas exchange over the time. So your respiratory muscles can also become weaker, and that can impair the effective breathing and coughing reflexes in older adults. They cannot cough with the same strength. So this leads to slower clearance of pollutants, leading to a prolonged exposure to inhaled toxins and particles. So if they are exposed to pollution, they are always in a chronic inflammatory state. Now, this will lead to, there will also be a decline in the immunity. Okay, this reduces the ability to fight the respiratory infections and recovers quickly. So there is another thing that happens to elderly. They have lots of comorbidity disease. So they're very unlikely. They might be having, diabetes. They might be having high blood pressure, cholesterol issues. But two things which lung related, which is common in elderly that Dr. Koushik already spoke about is COPD. So COPD and asthma, obviously, which increases the baseline respiratory vulnerability, will get exacerbated when you are exposed to pollutants. Then the chances of congestive heart failure, that is heart disease, diabetes, okay. But one thing we want to talk about is also memory. So memory or cognitive impairment can happen if you are exposed to air pollution, because you can go in a state of delirium. So that is also very important when it comes to elderly people getting exposed to, with comorbidities, getting exposed to air pollution. Lastly, one important thing is frailty or reduced reserves. So frailty and reduced physiological reserves limits the recovery capacity and increases susceptibility to stressors. So in geriatric medicine, we use the term physiological reserve. That means the extra capacity our organs have in case of stress. Now, as we age, this reserve will become very low, like a battery that can no longer charge to 100%. So even a small rise in air pollution for a 30-year-old, it might not even be noticed. But for an 80-year-old, it can push him for breathlessness, chest discomfort, and tiredness. So pollution is not just an irritant for an elderly person, but it is a tipping point. Can I move on to the next slide? So yeah, Dr. Koushik has already spoken about what kind of symptoms can be seen and how poor work quality will affect your body fast. So breathlessness, as I said, persistent cough. Okay, again from cardiac point of view, there might be palpitation, there might be related blood pressure elevation, acute response to pollution exposure, and you can also have chest pain. But other than that, you can have burning or irritated eyes. You can have a constant headache and a feeling of dizziness. Okay. And the most important thing that we notice in elderly people is they also suffer from sleep disturbances. So if the air quality is poor, it starts impacting their sleep quality. So that leads to, again, cognitive issues as well as the chances of fall, which becomes very high in an elderly person. So, pollution can itself lead to fall. So that is also very important. So high pollution, what happens? It will ask an elderly person to stay indoors. You will say the air quality is not outside. It is not good outside, so they can't walk. So as a result, they lead to less walking leads to stiffness, reduced balance, and weaker legs, which was seen mostly after during the COVID pandemic. Then you combine that with eye irritation, the tiredness, the dizziness. So the chance of fall keeps on increasing. And fall is a major geriatric emergency. So that is the reason, it can lead to fracture, it can lead to long-term hospitalization. So all of this can start with a simple breathlessness because of air pollution. Can we move on to the next slide? As long-term health benefits have already impact of this one long-term health impact has already been spoken by Dr. Koushik in details. I'll just speak on the impact on brain and cognition. So as you are exposed to air pollutants, there is an increased risk of dementia. Okay, it is associated with long-term pollution exposure, and it leads to neuroinflammation. So just like your body is in chronic inflammatory stage, especially for people with diabetes, same goes your body. You can be in a stage of neuroinflammation. So the memory declines and your cognitive function starts reduced. So it starts impacting your daily living and your independence. There might be a little bit of delirium. As I said in the beginning, there might be confusion or daze. So as sir said, brain fog. So those kind of things start impacting an elderly person's quality of life also. So that can be an impact of air pollution's long-term exposure. Can we move on to the next slide? So what happens? Why is it worst in geriatric or the elderly group? I have told you, we have discussed a lot, I think, about COPD. I said because it is more common in elderly people. So that is one. The second thing which happens to elderly is heart failure. So if patient already has an existing heart failure, it can get worsened because of air pollution, because there might be fluid retention, which can be because of inflammation or stress on cardiac function. So it will increase the risk of edema. As a result, there can also be arrhythmias, which can be provoked by pollutant-related autonomic imbalance and systemic inflammation, leading to irregular heart rhythm. Diabetes, again, high blood sugar can be pollution-driven because of systemic inflammation and impaired glucose metabolism. Patient can come with insulin resistance, increased by chronic exposure to airborne pollutants, and disrupt metabolic pathways. Another thing of note, as I said, is frailty. So because of the pollution, you're moving out less, and that limits your physical activity and your endurance capacity. Muscle weakness by itself can get accelerated because of these chronic inflammatory effects of pollution, and it will lead to sarcopenia and fall risk. Shall we go on to the next slide? Yeah. The only thing of note on this thing, I think we have spoken so much on pollution, on which cities of India has what pollution in PM 2.5 factor. But one important thing I want you to remember is air pollution can decrease your life expectancy by 5 to 9 years. And 20 to 30% of COPD exacerbation throughout the year in India is linked to pollution exposure. So these are key factors, especially if you have elderly people at home, you should keep that in mind. Next, please. I don't think I'll talk more on indoor air pollutants because I think Dr. Koushik has already covered so much of it. But one important thing is, yes, sometimes, we use a lot of incense and all for sleeping also. So that, and in elderly people's room, you have always, as geriatricians, we suggest please use carpet or rugs to, cushion your falls. Even those can be a cause of pollution or allergens. So those are things, especially if you're somebody in the winter season, you try to avoid those things in your rooms. So that could be a part that you should avoid when it comes to indoor pollution. Next, please. Yeah. The first thing in elderly, we always say movement is very important. Keeping yourself independent is very important. So first comes your morning walks. So if the air quality is poor, one practical tip is avoid walking in early mornings. Okay, either you go for a late morning walk or for evening walks. Especially check out the air quality index of your area that day. If it should be below 150 for you to step out. Okay, and in the main roads, in traffic laden areas, try to avoid them. And keep your doors and windows closed during the peak pollution hours. And yeah, you can use air purifiers. Okay, you can use air purifiers. And obviously Dr. Koushik also say, I would also like to stress again on should maintain good hydration, because that can again lead to other sets of problems. So this is very important. Next, please. Mask and medication. I think he has already said we should use the N95 mask without valve. But if you are a frail elderly person, then you can also use a light surgical mask, and you can maintain those indoor precautions that we talked about. As far as medications are concerned, it is very important, especially if you are somebody who's already having a disease, you should know you have a correct inhaler technique, you are aware and you are doing it properly. Then yeah, you should be on your regular COPD or asthma medications. You should not skip the dose. And vaccines, he has already spoken. Vaccines are as important in elderly people as in the seniors. So every year you should take your influenza vaccine. Okay. for which should be an annual vaccine after the age of 50. And if you're anybody above 65, then you should take your pneumococcal vaccine dose, which if you're having an existing disease, there will be 3 doses. And if not, you can have 2 doses, which will be spaced out within a period of 1 year. So these are all Government of India recommendations for elderly for vaccination. So vaccine should be something we should take seriously. Why? Because it will help us to reduce the chances of getting a flu and pneumonia, and it will reduce your hospitalization chances. So because of that, vaccines become very important. And yes, whenever you're going out for a walk, if you're somebody with a COPD, you should always keep a rescue inhaler available on you. I think those are important from a mask and medication point of view. Next, please. So, so as if you are somebody who's taking care of an elderly person, I think these are a few things you should remember. For an elderly person, this is also a major health issue. Okay. It not only affects your lung, heart, and brain, but it affects your immunity and life expectancy, which is very important. And indoor precautions are equally important as outdoor precautions. Okay. And you can start with small preventive steps, like, not going out for a walk when the air quality is not good. Instead, walking inside the house, you can start with that. And if you're someone who's taking care of a senior, so you should also be aware of that the senior must be protected proactively, just like how you want to protect your younger children. I think you should protect. And if you're somebody who's taking care of an elderly person, you might be feeling the stress on those high air pollution days more yourself, because your senior must be breathless. They might having any nighttime discomfort, and you'll be monitoring them over the night, getting up again and again. So try to avoid any caregiver burnout, because you should not ignore your own health while taking care of them. So from a geriatrician's point of view, the message would be that pollution does not just affect lungs, it affects the whole older person. Okay. Their brain, muscle, mobility, medication, independence, and the one you are taking care of, the caregiver. So protecting older adults from poor air quality is not optional. It is essential for having healthy aging and a good dignity in their elderly life. I think with that, I'll conclude.
Thank you, Dr. Priyanka. I think we've pretty much covered all the aspects of how air quality and lung health associated risk with elderly. Let's move on to the questions now. We have many follow-up questions here, especially around the lines of what steps to be taken. I'll take them one by one. What are the steps that can be taken by urban or rural community as a whole to reduce pollution? They're asking on community level steps or interventions to reduce pollution.
So at the community level, I basically feel if you are in a rural setup, make sure you don't burn crops there. So that is the actual cause for poor air quality in the rural areas. But when you come to urban areas, I think there must be community level consensus that we use more of public transport and then use less of individual bikes and cars, so that the total emission rate goes down. That is one thing which we can do as a community. I think that is what we can do. And then probably the community can also decide on moving towards cleaner energy for indoor cooking. So that would be my take.
More to add, doctors? Shall we move to the next one?
Yes,
We have a question asking, in city like Delhi, where AQI is going above 400 and condition of AQI remain more or less the same for the entire day, the option suggested by you, like N95 mask, is it enough to protect family members? Or the filters you mentioned need to be installed in every room?
So when it comes to AQI, I think when it gets worse, like more than 100 or 150, the only option we have right now is either go out with the N95 mask or at least a surgical mask, which actually protects up to 50% of pollutants, but not the PM 2.5 ones. If you want to get protected from the PM 2.5 ones, then probably you have to go for N95. There's no other option. Or the second option is to stay home. So I think there is only one way to go about it, wear a N95 mask and go out. That is that would be my take for the first one. And second one, for HEPA filters for all the rooms, I don't think it is necessary. You should actually place it in a room or a space where you're spending a lot of time. So that is more important. So probably you can also use a HEPA filter if it is a single floor, single story house. Then keep the rooms open and then use it for a while, and then so that it can purify a bit of bit from all other areas also. But the take home is like keep it in a place where you're going to spend a lot of time, like a living room or one particular bedroom where you're going to be there for a lot of time. That would be my take. I think I'll wait for the other panelists.
No, I agree with Dr. Kaushik here that HEPA filters that you were saying about, it should be it should not be room to room, but yeah, in the room you spend most of your time. That is one thing. And second thing, you are talking about your air quality index, and you're protecting your family. So even Dr. Janani said you have to prioritize your vaccination also. So that also has to be an important part. Be it you're having senior at home, you have children at home, so they need to be vaccinated properly to avoid the long-term consequences of this. So that is also important.
Shall we move to the next one? There's a question asking, is there any device to check the health of our lungs? I think they mean by that tools to check, air quality, or I think they're talking about the tools to check air quality. Any suggestions? Is
No,
there any device to check? Yeah.
So when it comes to air quality, I don't think you don't have to check because the government is already publishing it in the AQI website. So you just have to select your area, and then and then you can identify what is the AQI for today. So that is predominantly for almost all cities. That is one thing. When it comes to checking your lungs, yes, there are spirometries which are available to check how your lungs are performing, especially the windpipe. And there are two more modalities which are available, which is called as fractional exhale nitric oxide test and oscillometry test, which actually tells us what is the amount of inflammation which is going on in the airways, and also tells us if there is any early small airway diseases which is triggering in, so that can also be identified. So I'll say spirometry, pheno, and FOT. These are the three tests which are available as of now.
There is a question asking what kind of mask are more recommended, cloth or surgical? Cloth mask or surgical mask?
So technically, any covering over your nose actually gives you a bit of protection. So let it be cloth, or let it be surgical mask, or let it be N95. But depends upon what PM particulate matter or what you are getting exposed to is much more important. If you're getting exposed to particulate matter 2.5, definitely needs N95. Nothing else is going to prevent. But if it is going to be a little higher particles, then probably a surgical mask, like I said. Even cloth mask gives you a limited protection up to 20 to 30%. So I think anything is good rather than not wearing anything when you're going out in a polluted area. But N95 is the best. There is no doubt about it.
Next is, are there early warning signs that poor air quality affects lung health? What are the early warning signs that one need to watch out for?
I think I would like to speak from the elderly's perspective. So as Dr. Koushik also said in the beginning, the first thing is the irritant cough, the breathlessness. So those are few things. And as I said, a lot of time elderly people get confused between something which is because of age and something because of pollution. So, having a chronic irritant cough suddenly because of being exposed to, stepping out of the room or being exposed after going out for a walk. So those are few things you should definitely watch out for. I think Dr. Koushik would like to add something to it.
To what, sorry?
What are the early symptoms?
Early symptoms.
So I think we just did a bit of it on the slides as well. Like, see, the early warning signs predominantly would be you suddenly getting a cough or suddenly increased mucus production, and then you feel little breathless while you're climbing up, which you not had before, or you have a slight wheezing, especially when you go outdoors or seasonal when the pollen counts are really high. So fatigue is another important sign. So all these things are a few of the early signs. Like to put it together, I would say cough, wheezing, and then excess mucus, excess phlegm production every day, and then your fatigue. So these are the, and then breathlessness. So these are the five things which I would say would be early warning signs. And then you should also make sure that once you have ruled out of any other disease, like, see, this could be, all these symptoms could be part of any respiratory problem. So once you're ruled out of any structural or functional problem, then probably you should correlate it to air pollution also, which I think in future years people would be more keen on correlating it to, because as of now nobody actually tends to ask a patient what kind of air pollution they're exposed to. I think in future that will be a part of history taking also, like what kind of place they come from and what kind of quality of air is there would also be a part of our history taking. I believe it should be there.
Dr. Janani, we have a question asking what can schools do? Because they have these outdoor play routines on high, like, so what can schools do, especially on high pollution days, like in terms of uh, interventions or tips when it comes to children? Can can you hear us, Dr. Janani?
Yeah, yes, ma'am.
Yeah, yeah. It's We have a question asking what can schools do to help children?
Yeah,
Yeah.
yeah. Now most schools are air conditioned, and I'm sure they're not doing a regular cleaning of the AC filters. I think
Mm-hmm.
they have, if they use air condition in the schools, they have to clean the filters, AC filters periodically, and probably I would still prefer them to have a non-air conditioned classrooms are much better. Schools also should avoid, I mean, do a deep cleaning when the schools are closed. I think probably they can do a deep cleaning of the schools. That's what the schools should do.
Absolutely. We have a question asking, are there any substitute for mask as elderly? They feel suffocated with mask, and is there any substitutes or what tips can they follow in, at times like?
I think I put that out there before only. The first thing is people who are frail, you cannot, especially people, elderly people who are frail, they cannot happy with the N95 mask. They feel it is more suffocating. Then a surgical mask is always a better option. It is lighter. And, as Dr. Koushik said, you should go for with all the indoor precautions, starting from that cross ventilation, not putting him in the damp room. So it starts with all of those things also. Then, having your light plants there, avoiding incense in the room, avoiding coils, avoiding aerosols in the room. So those are the few things you have to take, other than taking out. If you are taking them out and you want to use a mask, then it is better to go for a surgical mask. It is much better and it is easily tolerated compared to a N95 mask.
We have a question asking recommendations to the government, and what policy level changes or recommendations are needed.
I think policy level is quite clear, like uh, switching from regular energy to clean energy. That is more towards electric vehicles. That is one major policy decision which has to be taken, especially with the increasing number of cars and bikes which has been coming into the market. And then number two is probably educating all the public regarding air quality and how to contribute to a good air quality. That is also a part of government, which they should make as an initiative. Probably they could probably they can also introduce these things in the schools and colleges also. So to teach people about how important is air quality as a part of policy making. Third is about waste management. They should not go with traditional burning of waste things. You should go for cleaner alternatives. That would be the major thing. And then also about alternatives for farmers to burn crops. So that should also be considered as a policy change. I think these would be the four policy changes uh, which should be implemented in a war footing to make sure the air quality is clean.
There are many questions on how children between 1 to 5 years of old, since how indoor and outdoor precautions, what kind of indoor and outdoor precautions they need to take from air pollutants effects. We have briefly touched upon that, but if Dr. Janani can, okay, I think we lost her connection now. Sure. I'll take that up later in the session. We'll move on to another question. This too we briefly touched upon, but I'll still take it. Are respiratory impacts more serious or on organs like heart and kidneys of poor air quality? Also, how much exposure is damaging? For example, I'm exposed to poor air quality mainly while cycling for work and back for 30 minutes each day. Is that okay?
Like we discussed, yes, of course, poor air quality will impact all organs, especially if it is particulate 2.5, which can actually get into your lungs and also get into your bloodstream. So this you have to keep in mind. It's lung is just the gateway for all your harmful things to enter your bloodstream. So that is one thing. It can definitely affect your heart and brain and also your kidneys. The second thing is about how much exposure is damaging. We don't have clear-cut scientific data on that to say, okay, this much of exposure is harmful. Like how we have for radiation, we don't have for air as of now. But like I said, if your exposure is going to be perennial, like every day you're going to be getting exposed to a poor air quality, even for 10 to 15 minutes of your day, then probably that is really harmful. But if it is going to be once in a while, like say once a month, I'm going to get exposed to this kind of air pollutants, then that's fine. But on every, like for instance, in this case, he is saying he is going to get exposed to poor air quality every day for 30 minutes. Then we have to assess what is the air quality index he is going to pass through. If it is going to be more than 150 or more than 200 and 300, it's definitely harmful. There is no doubt about it.
We have a question asking sorry. Yes, Dr. Priyanka, please.
No, I just wanted to add one more point to what Dr. Koushik is saying, that your question also highlights the fact that does it impact only the lungs? As Dr. Koushik said, lung is the gateway, but we also discussed that heart is important. So is the kidney. Kidney by itself, if you are somebody with already existing kidney issues, your reserve will be low. So if you are exposed to air pollutants, which you are in a state of chronic inflammation, your fluid retention, metabolic acidosis, those conditions will increase. Same goes for your brain. It starts impacting your memory. And again, same goes for your full physique if you're in a state of chronic inflammation. So yeah, it affects all organs. Lung is the starting point and it affects all of it. So you have to take into account all of it.
Next question, we have a question asking, are natural remedies like steam inhalation or salt therapy useful, or are they just myths?
Sorry, can I have the question again? Sorry.
Okay. Are natural remedies like steam inhalation or salt therapy, etc., are useful, or are they just myths?
I think steam inhalation has a very big role. So it's not only in clearing the airways, but it also has a very big role in reducing the inflammation of the airways. So steam inhalation, yes, it has a very big role, but make sure you don't add anything to it. Like they say, now I have added this capsule, I have added the turmeric, I have added the salt, I have added the pepper. I don't think you should add anything to it. It is just plain steam which you have to inhale. So it has a very good role in bringing down the inflammation and also cleaning your airways. And coming to salt therapy, I'm not sure what he means, whether it is by gargling the throat or something. Yes, if that is the case, yes, they can do it. It has a very good impact as well. And third is like they can also do a simple saline irrigation of the nose, which will also help to reduce the pollutant burden of the nasal cavity.
Shall we move to the next one? We have a question asking to detail how dehydration or poor nutrition worsen pollution effects, especially in older adults. But we can talk also generally.
Yeah. So just to speak on first, as you said, dehydration and poor nutrition. So as I talked in the very beginning, the physiological reserve itself will be very less. So you have to supplement as you get older. You will be losing your fat, so lean body mass is reducing. So in those kind of scenario, it is very important that you have the proper nutrition supplements. Okay, Dr. Koushik also put importance on things like eating getting your omega-3 supplements, your vitamin C, your vitamin D3 supplements. Those are the ones which helps us to boost your immunity also and keep you protected from any stage of chronic inflammation. So that is one thing. And coming to hydration, repeatedly we have been saying hydration is very important. Again, for the same reason, air pollution by it can when you're in a state of chronic inflammation, it can itself expose you to state of dehydration, which will lead to other problems like hyponatremia. Your sodium levels might come down, or any other dyselectrolemias, meaning your potassium level goes up, your heart rate goes up. So all of those things can happen just as a part of this. So hence we already are focusing a lot on being hydrated. So what happens, we are using the humidifier, and then we are already hydrated. We feel, as a symptom, we feel lot of thirst as a part of being exposed to air pollution. So as a result, we sometimes we end up hydrating a lot, but you want to avoid hydrating. You don't want to be drinking 2.5 liters of water is okay. Going up to 3 to 5 liters of water because you have a dry throat, that is also problematic. But not drinking at all is also problematic, especially in the winter months. So you need to be meeting, if you are not somebody who's having a water restriction in your diet, you should definitely meet up to 2 to 2.5 liters of fluid intake in total. So again, diet and nutrition, both of them are important that way.
There are questions on how it affects academic performance and sleep cycle as well, and tips to improve on that ground, because it's unavoidable.
Sorry, I didn't get the question. Sorry.
Adding to that question, there are follow-up questions asking how sleep and academic performance is also affected, and how can we, are there any tips to follow to mitigate that?
So, sleep as such is very, very vital. Like it is as vital as how you breathe or how your heart beats. So, it is something as vital as that. And the problem with sleep here is it is not like involuntary, like your heartbeat or your breathing. Sorry, heartbeat or your breathing. Yeah. Here, the sleep is completely partially dependent on the personnel also. So, a lot of people tend to take sleep for a task and then they don't sleep the adequate number of hours, which is required to maintain a proper body regulation and also the hormonal balance in the body. So, once the sleep is disrupted, everything gets disrupted. It's not only academics, I think all other metabolic components also get disrupted. So, I will keep it little short. So to answer the question, sleep is very important. Make sure they sleep at least 7 to 8 hours if they are in the age group of 12 to 40, and more than, I think after 40 there is a little bit of decrease in the sleep as well. I think doctor might explain about it. But for the academic purpose, yes, definitely sleep is important. They should minimum sleep for 7 to 8 hours, and it should be a high quality sleep. It should not be an interrupted sleep. It should be a high quality sleep. And if the sleep is good, the cognition and memory also improves.
And just to add on to that, just one line, Athira. The thing is, as sir is saying, as you get older, the sleep will automatically be less. In an elderly person, we assume them to have 4 to 6 hours of sleep minimum, especially if they're having sleeping disturbances and being exposed to pollution by itself. When the sleep starts impacting your memory, the first thing of concern is, as you use these humidifiers in your room during your night hours, similarly, you should also maintain some good sleep hygiene habits, because that will start impacting both your memory as well as your quality of life. So those things can help.
Questions keep coming in, but we are out of time, so we'll conclude for today. Please drop in your questions in the comments. I'm sure doctors would take it even after the session later. So thank you all our speakers, and for the comprehensive presentations, and to the viewers who kept it engaging with all those questions. So today's session, we highlight that air pollution is no longer a seasonal concern but a year-round public health emergency. And children, older adults, and those with chronic illnesses face disproportionately higher risk. Awareness, early medical guidance, and household-level preventive strategies can significantly reduce harm. Stronger public policy and community participation are essential to creating healthier, breathable cities. We hope this session helps you to take informed steps to safeguard your health and that of your communities. Wishing you all a healthy and safe day ahead. Thank you all.